I've just never had the need for that power, so it's not that I'm unimpressed. I just
This is the kind of
wouldn't know what to do with
superhero
it.
that, yeah, that it's just, you can recognize that something would qualify as poultry and not. So it just, there's no real particular need for it, but this is how I would be as a superhero. I'd have superhero abilities that would serve no purpose. Like, I don't know, I could see through wood, you know,
Well,
that'd be it.
that's X-ray vision is what that is.
Yeah, but nothing else, only wood.
Well, I was told by my past police chief that my superpower is common sense, so I have carried
There
that
you
forward.
go.
So,
See, that's useful.
That is a good one. That is a good one. I tell my husband he has lots of useless trivia in his head.
Oh, I've got that.
That's the Cliff Clavin effect, is what I call that. Cheers throwback.
So I think we have the whole Hee Haw gang here. So we'll go ahead and get started. So welcome everybody to our weekly news conference regarding all things COVID-19 at Indiana University Health, City of Bloomington, and Monroe County. We will get things started with opening remarks, beginning with Mayor John Hamilton.
Thank you very much, Chuck. Good to be with you all as usual. Just quick reports on city status. We have 3 new employee cases in the last week. That was after 4 weeks of no cases altogether. So that was a bump for us in the wrong direction. All doing okay now. We've had 115 of our employees who have now signed up for the $100 wellness supplement as fully vaccinated, and we'll be encouraging more to do so. The big question, and I know we'll hear a lot about this, is are we at the beginning of a 4th wave, or are we continuing to see progress? We know locally we have seen significant increases in cases and hospitalizations. On this call, we always talk about how important it is to keep looking at what's going on. We've had really good progress since the winter, but we're going the wrong direction right now. State hospitalizations a week and a half ago were in the 500s. They're now in the pushing 700. They're not quite to 700. That's a big change. And the daily case average in the state was in the mid 700s. It's now in the mid 900s. It's certainly down a lot from the worst of the winter as we are, but it's no longer going in the right direction. We are not an island. We don't have different epidemiological rules that apply to us. And just looking at our neighbor, Michigan, where 6 weeks ago in Michigan, new cases were about 1,000 a day 6 weeks ago. Today, they are nearly 6,000 a day in Michigan, with the variant rising there. It is really a race, it appears, between the variant and the vaccine, and not clear who will win in the coming weeks. Right now in Michigan, for example, it appears that the variants are winning, at least ahead of the vaccine. I know we'll hear a lot more locally about where we are. I will just close by saying that in my view, Governor Holcomb's recent announcement to remove the mask mandate at the state level is terribly misguided and unfortunate. The state health commissioner Box expressed her concerns about where we are. It just makes no sense to me, given the risks in the coming weeks and the importance of staying the course to avoid a possible 4th surge. It makes no sense to me to make that change. The governor has defended and continues to indicate that plan. As we know, locals can keep our controls in place. And I know you probably have seen and you'll hear that all of us on this call are holding arms together and planning to keep that going and supporting the health department in their great work in that regard here locally. So we really have important work to do. I'm disappointed that the state has taken this step, but we can locally keep doing what we need to do to try to keep ourselves in good shape. I'll hand it back to you, Chuck.
Okay, let's next check in with the county and Penny Caudill.
Good afternoon, Chuck, and everybody. Thanks for joining today. So the Monroe County COVID-19 health orders and regulations will stay in place for the time being. We will not be moving forward as the state will do next week. That means that masks will still be required in public along with physical distancing. Retail food establishments and bars will continue current restrictions regarding spacing, masks, closing time, bar service lines, no buffets, all of those kinds of things. Our gathering size limits for social and commercial venues for the county will remain at 50. Social gathering limits for this within city limits will remain at 15. You can, if you're having a gathering and want to submit an exemption, you may still do that. The regulations will be reviewed by the Board of Health and the health officer again on April 6th at the next board meeting and determine if there are other changes that are in order at that time. The county has seen an increase in cases per 100,000. We reached 128 per 100,000 this week on the metrics map. A month ago, we had dropped down to 63 per 100,000, and we had a single day where when we calculated it, we were as low as 49 per 100,000. So we are definitely seeing an increase. When we look at February 3rd, just to kind of put things in perspective, on February 3rd, we had 171 cases per 100,000. On March 3rd, we had 63. And on March 31st, we were back up to 128. When we look at that in terms of the cases we were seeing per day, kind of on a rolling average, on February 3rd, we were in the mid 30s. On March 3rd, we were in the teens. It was like 13. And on March 31st, we were back in the mid 20s. As we've said, this is the wrong direction. There is some positives in this, in that vaccine is available. More people are being vaccinated. So we are seeing fewer cases among older people over 60. We do see some, but we're not seeing a lot of cases in people over 60. Most of our infections are probably in that 20 to 30-year-old group, but we still see them in all age groups. Infections do tend to be a bit milder, but we know that variants are present. Indiana has identified all 4 variants, at least 1 case of each in Indiana. The UK variant has been seen in 51 states, 136 in Indiana, and Indiana has seen 6 cases that have been identified of the California variant, 2 of the South African variant, and 1 in Brazil. And this was from earlier this week, so this may have changed. We know that every specimen is not checked for the variant, so these are minimal numbers. It's what we know at least we've seen. So we do need to maintain our precautions, support businesses by being cooperative, and get vaccinated as soon as you are able to do so. By doing that, we can reach the opportunity to ease restrictions and move forward in what might be a more normal, feel a little bit more normal world to us again. In terms of vaccine, which is very, very important, Indiana has over 1 million people now fully vaccinated, and that is definitely good news. More than 2.7 million doses of vaccine have been administered in Indiana. So those are things that we can be very proud of in terms of Indiana. At this time, everyone 16 and over is eligible to be vaccinated. Keep in mind that those individuals who are 16 and 17 years old must get Pfizer vaccine because that's the only one that is approved for people 16 and 17 and above. If you are 18 and older, then you can get any of the 3 options that are available. So we do want to talk a little bit as well about our clinics locally. We've provided over 7,000 vaccinations at the convention center. And I do think that I misspoke last week. I just want to clarify this. If I did, I think I may have said that we had done over 12,000 and there was just a snafu in my spreadsheet that was adding something twice. So just want to correct that. If I misspoke, I apologize. But we have done over 7,000 vaccinations at the convention center. And we are excited that we've sort of finished our planned first doses there. We will finish out those individuals so that they also get their second dose of the vaccine at the convention center. IU assembly halls site opened this week, very, very smooth. Kirk will tell us more about that. We'll let him do that. That is a smooth operation as well. One thing that I do want to say, and this is kind of good news as well. We've talked about vaccine demand in our community and that people want vaccinated, and we're very happy about that. We are finding it's getting more difficult when we have people who have canceled an appointment and we need to fill it, or we have an end of the evening dose that's available. It's getting harder to find somebody to take it. Wednesday, when we had clinic, we made over 60 calls to get 30 people in for appointments that kind of had been canceled. So we're working very hard, keep signing up for those standby lists. It may prove well, but it does tell us there are lots of opportunities, because when we're calling people, they're telling us that they just got their vaccine perhaps yesterday. So people are paying attention to the vaccine sites, and they're continuing to check in with that. The platform for appointments does now have Spanish translation, so that is a plus as well. And we continue to plan for further outreach events and possible mass clinics. The Indiana Department of Health has also brought on large businesses to assist by vaccinating their employees. And we do have plans that as more vaccine is pushed out, that will also be offered to smaller businesses that have employee clinics as well. And eventually will make its way to providers' offices and be a much more routine process of being vaccinated. So we also encourage people to continue testing as that is needed. If they're symptomatic or they've traveled, wait those 5 days and then schedule your test. If you've been exposed, schedule your test. So we encourage people to do all of those things so that we can get to the finish line with this.
Okay, thanks, Penny. Let's next go to the Monroe County Board of Commissioners and Lee Jones.
Thank you. Yes, Monroe County is continuing to give out CARES grant funding. These are grants and not loans, and they're available to assist with COVID-related non-payroll expenses, which have not been covered through other funding sources, loans, or grants. You can go to co.monroe.in.us for further information and also the application. We will continue to accept applications through April 30th. Also, the commissioners have worked with the council to develop a township assistance fund for township trustees. With this funding, township trustees are able to assist county residents with basic necessities such as rent and utilities during difficult economic times. Every resident in the county does live in a township and does have a township trustee. If you don't know who your trustee is, you can look at the Emergency Management Department's page on the Monroe County website, which is, once again, co.monroe.in.us. And that'll also have information about where the township office is. Thank you.
Okay, let's next go to Monroe County Emergency Management Director, Allison Moore.
Thanks, Chuck. I am happy to be back. I was out last week spending some much needed time with my family, and I appreciate the invite to be back this week and to continue to thank our media for being on these calls week in and as we continue to give these updates. I'm excited to announce that on Wednesday, the Board of Commissioners signed a contract for the next 3 years for our mass notification system. As I've announced numerous times, and I will continue to be a strong supporter of our Monroe County alert system. We are very fortunate in Monroe County that we have such a free service for our residents that allows them to get weather-related events, updates on travel statuses, as well as any health order or updates and such. So I encourage residents, if they have not signed up for that, to go to that co.monroe.in.us website and get signed up. We have had several phone calls about that notification system. So just for the public to be aware, we had a line that was designated for that system, and Everbridge, the company that we use, has now indicated that we have to have a local number. So we have assigned a local number that sends out those alerts. And because of that, it's sometimes confusing to residents because it's a local number. They've maybe missed a call. Maybe they didn't answer it because they weren't sure who it was. They thought possibly it was a spam call and such. And so then they're calling that number back, trying to find out who it was. So we encourage you, if you do receive the mass notification systems by phone call, that you might also check to go in and activate those as a text or an email as well. And that way, if you do happen to miss those calls, you can then find what that message is by doing that. We often will also send out those alert messages to our website. So if you do happen to miss that call and you call back and you get our automatic number letting you know it was a notification, oftentimes you can hop to our county website to get that information if you happen to miss it. We do have blood drives continuing to be scheduled. I'm always impressed with the amount of people that we get signed up for those drives. We have had a complete list. Every single slot, every single month has been filled, and that's just phenomenal. But we are getting closer to those April dates, and we still have quite a bit. So we'd like to continue with our success. So I encourage you to go to our county website to find the dates that we have scheduled between now and June, and then find a time slot on the redcross.org website and make that appointment to help make those donations for Monroe County. We continue to shuffle PPE around. We had a need just this week for some more paper gowns for a couple of our fire departments. Our office will continue to make sure that our public safety providers have all the necessary PPE in order to continue to fight COVID. And even a year into this, we continue to make those requests happen. And so we are excited that we have continued to have those partnerships with those public safety providers. And that's all I have, Chuck. Thank you so much.
Okay, let's next go to IU Health and Shauna Gerges.
Hi, Chuck. Good to be with you today. Just a few things talking about. First of all, I'd like to congratulate our friends at Indiana University for standing up their COVID-19 vaccine site. IU has been a part of the COVID fight from day one, and their willingness to support our community by setting up a clinic continues to show their commitment and dedication to our entire community. Their participation in vaccination efforts is bringing us that much closer to winning the COVID battle. So thanks to all of you at IU. On a few things about data, we've continued to see a low COVID-19 inpatient census across our region, which you can see as well and here in Monroe County, which remains promising. However, as was mentioned earlier, the state has seen an increase in positive cases as well as hospitalizations. And these have been the first increases that we have seen over 20 days. While the numbers aren't large, it does cause us to pause and just ensure that we are doing everything that we can to protect ourselves and our communities until everyone is vaccinated. As of Wednesday, our IU Health ICUs statewide were 86% occupied, and regionally, our IU Health ICUs were 69% occupied. We are glad to report that our teams and resources continue to be in good numbers. Through yesterday, speaking about vaccines, our Bloomington and Paoli clinics have administered 62,279 vaccines. And earlier this week, we administered our region's 60,000th vaccine in Bloomington, which you can see from this slide, and our happy patient and provider. As of yesterday, the Bloomington Clinic has administered 46,370 of the 49,820 vaccines that we've received, for a 94% utilization. And as we've been talking about the variants, just a mask reminder here. While we know that the mask mandate will be removed across the state next week, masks will continue to be required at all of our IU health facilities at this time. Our safety precautions are aimed at protecting all within our walls, whether they're team members or patients or visitors. As you know, healthcare facilities contain some of our most vulnerable individuals in our communities. So it's vitally important that we continue to follow mask guidelines, even if an individual is fully vaccinated, as it's the best way to truly ensure a safe environment for everyone. And we are very appreciative and supportive of our community's continued response to keep restrictions in place while we allow more of our community to receive their vaccine. This allows more time to ensure that we don't see a surge from variants such as the other states that were mentioned earlier, like Michigan or Florida, that have removed their restrictions. And then lastly, for those that are celebrating Easter this weekend, please remember to continue wearing your mask and social distancing when around people who don't live with you. Even small gatherings have the potential to spread the virus. And while our hospitals are seeing fewer COVID patients, we still have new COVID patients coming in. So we know the fight isn't over. So we just ask you to please celebrate responsibly this weekend. That's all for today, Chuck, and I'll be happy to take questions at the end.
Okay, let's next go to Indiana University and Kirk White.
Well, good afternoon, everybody. I'll start out with the numbers. As has been reported, the university numbers are tracking along with the state and community numbers as well. We've seen a slight uptick this past week. Our prevalence rate the week of the 21st was 0.4%. And I think that's going to bump up another couple of tenths maybe as we get all the results for this week. We have seen some scattered outbreaks in various places that we're able to immediately identify through our contact tracing and our testing protocols. And so what we've seen is exactly what we've talked about on this call. What we've seen is a trend of folks who have been traveling have come back to the state with additional levels of virus. So that's another good reason for this weekend, if you have family gatherings planned, to continue to be safe. But on the good side, because of our the mitigation testing that continues, and last week we tested 22,400 of our students, faculty, and staff, and this week we're on track to do the same thing. We're able to find where the infections are and get it isolated as fast as we can, and that's kind of increased our quarantine and isolation numbers for this week as well. So that's the news that's not so good, because it is trending a little bit up, and we expected perhaps this uptick after some of the travel that was expected to go on during the local school corporations break, even though the university did not have one. Now, as Shauna reported, we're really excited about the Assembly Hall vaccination site. It got up and running this Monday, and has really done great work. We've got plenty of capacity there, and I think the state is rewarding us with that. This week we had the full allotment that the county had from before of 780 doses, and we'll get all of those out by tomorrow afternoon. But next week, we expect to tenfold that and bump up to 7,000 doses. And those additional slots were available on the Our Shot site. And then we expect here in the next couple of days for the state to open up more slots on the Our Shot website. This is consistent with the state's new initiative to allocate additional doses to universities around the state. So what will happen is the state will be sending an email to members of the university community over the next couple of days. And that email will come from an email address that is listed as no reply at coronavirus.in.gov. So if you get that, that's something you should pay attention to. Open it up, and it will have a link to additional slots for the Assembly Hall site in this coming week. We will also be sending a university email out to remind students, faculty, and staff of this initiative as well. So really next week, we'll have both the open site where many of those reservations have already been made. There may be some openings left where there are cancellations. And then on different days, we'll have this site with the special state initiative to get university students vaccinated as well. So we'll be doing both next week, both the general public for the region and these specialized focused sites for distribution for students, faculty, and staff. Now, let me just say that part of our testing and monitoring of the virus, we know that the variants are in Indiana, as Penny Caudill mentioned earlier, and we suspect that that's occurring on the campus as well. So this is a particularly good reason to maintain the current protocols of masking and distancing and getting a vaccine as soon as you can. When you go to the Our Shot site, if you can't find a place close by, plug in your zip code and it'll show you where the next available closest site is. Go ahead and take it as soon as you can, because the variants, we have to remember that even if you've had COVID before, you might be more susceptible to a variant now. And so it's a good idea to go ahead and get vaccinated. Now, I'll close by just saying that Indiana University fully supports the county health department's continuance of the mask mandate here in Monroe County. It has served us well, and we think that it's a good course of action to continue to keep our community safe, and we're fully supportive of that initiative as well. I'll be ready to take any questions. Thank you.
All right, thanks, Kirk. First question comes from Dave Askins, the B-Square Beacon for Penny Caudill, related to what she mentioned opening up. Based on my own experience, he says, getting a second jab at the IU Medical Arts building this morning, they absolutely love it if you come in early, and that's because they're getting lots of no-shows in the last few days. He says he went in 2 hours early because the person who gave me the reminder call this morning told me I could. They said if people show up early, it helps them figure out their daily dose count better. So his question, based on the numbers that Shauna gave, it doesn't sound like no-shows are having a negative impact on utilization rates, or have no-shows been only an issue in the last day or so, and is showing up early for an appointment generally going to be okay, or is that just a one-off today?
Yeah, Dave, I'm glad you got your second dose of vaccine. 2 weeks and you will be fully immunized, fully vaccinated, and I'm happy for you. Thank you for sharing that. Demand and utilization is still high, and we still see lots of people in our community who want to be vaccinated. And I think that the no-shows and cancellations is just really due to people being persistent and looking for and finding earlier appointments. And then, it's not easy to cancel that appointment always. So that's really what's driving that. In terms of showing up early, each site may handle that differently. Their capacity for Early arrivals may be different, and it may be different on different days. I know at the convention center in general, if things are going very, very smoothly, an early arrival isn't really a problem. We can get you right in. But if we start to get a line, we don't want people coming early and then holding up other people who have earlier appointments. So that's always that dilemma. If you have 4 people come hours early, 4 is not probably a good number, but then you have people who come on time and now they're waiting because somebody went before them. That's always the challenge, and it will vary according to the capacity and how many appointments somebody has, whether or not there are early arrivals or cancellations, I meant to say, before you. So we encourage people to keep that appointment. If you can cancel it, that's great. It opens it up for someone else, but we are glad that the demand is high. And if you can't find a vaccination appointment in town, look at surrounding counties, because I will tell you that not every county is having the demand that we have. So it doesn't matter where you go, get the vaccine.
Okay. Next question from David Wolf Bender at the IDS for Kirk White. He asks if you can repeat those numbers on the IU site. Did I get it right that the site gave 780 doses this week? We'll give more than 7,000 next week. Can you elaborate on the reason why the university will see such an increase in the available slots?
Yeah, thank you, David. Good to follow up on that. Yeah, that is correct. We had the standard allocation that the state had provided the county this week, 780 doses. But because of this new initiative that the state announced this week to get university communities vaccinated, they've increased our allocation for next week. So we've been able to receive this additional number of doses. And as I said, over the weekend, we expect the state will be sending that email out for students in the university community to get signed up for those additional slots that will open up next week. So people should be watching for that.
And to that point, he asks to be sure he's understanding this right on those additional slots. All of those additional slots going to students and faculty and staff exclusively. Is that the case, or are they open to the public on those additional ones?
The invitation is going directly to the university community. And so they're the ones that will get that link from the state to go and get signed up. So it will not be a fully open public on those particular days. Now we'll continue the normal open site for the public on the days that we already planned to, Monday, Wednesday, and Saturday. But this additional site will be open with that special link for the university community.
Okay, so we don't have another question at the moment, so awaiting that here. And as we wait, Kirk, I'll just keep it with you for a moment. So can you describe, as Penny said, it worked pretty smoothly at the site this week, pretty much up and running from the very beginning? Any hitches there?
No, things have been great. In fact, I'll just show a picture here. If I can, did it come up there for you? Is it all right? Just to show you how well it's going. This is a picture of the site, and this is the actual vaccination places here. There are stations lined up along the lobby. And once you get done with your vaccination and it's recorded, you'll go over here to be in the observation area for 15 minutes. And while that's going on, you can kind of ponder over Assembly Hall. We have the lights and the curtains back so that you can take in the hall. And as well, we've also got places for you to take a selfie with your favorite IU athletes. You can pull those up on the screen and take a selfie of yourself there at Assembly Hall and have it texted to yourself. so that you can remember the day that way. So just a few things to make this a little more enjoyable. It's a fast process. You're in and out in 20 minutes, 25 minutes. And we learned, as I say, so much from our friends at the County Health Department that did this at Convention Center, and from our friends at IU Health at the Medical Arts Building. We were able to take lessons learned and put our layout together here. And we've got some great volunteers that are helping us from the county volunteers, as well as some friends from IU Health. And as I was there earlier this week, it's really great to see this is also being used as a learning laboratory as well. So we had members of the public coming through, getting vaccinated, and then they'll sit down and actually get vaccinated by one of our nursing students being supervised by a university faculty member. So they're able to get some learning experience down here as well. And so having that kind of experience, very positive. And so I think this will be as easy as it can be, and as pleasant as it can be to get on through and then come back for your second. By the way, we're doing Pfizer at this site. So those who are 16 to 18 will need to go to a Pfizer site, because the other two, Moderna and Johnson & Johnson, are not authorized for 16 to 18. So Pfizer is, and we've trained our folks how to be sure and have the right protocols in place for that under 18-year-old group as well. So things are looking good. We're in this for the fall, planning at least into the summer. And we hope to, as the state has asked us to do, get as many of our students as possible vaccinated, at least for their first shot, hopefully their second, before they leave for the summer. Remind you that the residency requirement was lifted, so you do not need to show proof of residency in Indiana. That makes it a lot easier. And then what you'll do, if you do have to get your second someplace else, just hang on to your card and make sure that when you go back to your home community or home state, that you find a location that's giving the same vaccine type that you received while you were in Bloomington. There's kind of an overview. Thanks, Chuck.
Thanks very much, Kirk. So question from Ethan Burks, WFIU, WTIU for Penny. He says, I know this may be premature, but there have been discussions about a timetable for closing local COVID testing sites after a large portion of the population is vaccinated. Have there been these discussions? I know that Morton Street site is scheduled to be open until June. Could you speak more on the future of testing sites in general?
I can a little bit, Ethan. The discussions are going on. The Morton Street site is through a grant and the generosity of our partners who are here, and scheduled to be open through June. There may be funding available to extend that, and we haven't gotten confirmation on that or any details yet. I believe that the state is currently working to keep the Optum sites open and in place through June as well. But there are discussions about what we do after that, because decommissioning a site and then setting it back up is very difficult, and testing is still important. Even with people being vaccinated, we are still going to have this infection circulating, and we'll need testing. So there are discussions about that. Most of those discussions are at a higher level. They're at the State Department of Health discussions, and we'll hopefully get more information about that. I would expect as we come into the end of April, early May, I think that they'll probably have a clearer plan for how they'll handle that.
This is from Boris Ladwick at the Herald Times, again for Penny. Can you provide more details on what share of new infections is occurring in people ages 20 to 30?
Boris, I really can't. I can just tell you, kind of looking at sort of what are the numbers coming in today, and just seeing kind of age ranges. But it's just kind of a scanning of those birth dates. But I can tell you that most of them, as I said, we're seeing them all ages. I see them in people over 60. I see them in people 40 and 30, but probably most of them are in that 20 to 30-year-old range.
Okay, I'll hang on here a moment. If there is another question, we have a few minutes left and still a little ways to go. And I'll take this moment as the IU spokesperson to remind you that covid.iu.edu is where you can go for information about anything related to Indiana University and the COVID pandemic. And I would also plug the other webinar thing that we do during the week, which is an Ask Aaron webinar. If you have a chance to check those out, those are all archived at broadcast.iu.edu. This last week was all about vaccines. We did 90 minutes, which is 30 minutes more than we normally do. And that actually provided about as much information as you could find about vaccines at this point. A lot of questions answered there. So I encourage you to check that out at broadcast.iu.edu. And we have more of those webinars upcoming. Seeing no other questions, we'll give you 5 minutes more of your Friday back. And we appreciate the questions and the attendance again. We will be back next Friday at 1:15 to talk about COVID-19 in the city, county, and IU Health. Thanks, everybody.
Thank you.
Thanks, Chuck.
Everyone.